Welcome to Direct from the Doctors. I'm Dr. Emily Vincent, and this is my friend and colleague, Dr. Tracy Lamel. And we're here today to talk to you about breast cancer health and awareness.
You will start seeing football players with pink shoes and pink jerseys and pink headbands.
With pink everywhere.
With pink everywhere. And
Right.
It is that time to go. If you have not already made your annual Well Woman visit, it is time to get your Well Woman visit. And part of that visit is a mammogram for certain age groups and certain risk factors. So in general, mammograms are recommended at age 40 and older. However, depending on your family history, your personal history, and any risk factors you may have, it could be sooner. But it is that time of the year to get those things done so that you can reduce your risk for breast cancer. Mammograms allow women to get breast cancer detected earlier, and the earlier you get breast cancer detected, the more likely you're to have a less invasive treatment and a more successful treatment. So we always recommend that women do that for the health of themselves and their families, because it's not just you have to worry about these days. You have to worry about the rest of your family who count on you.
Sure.
So
Absolutely. So one of the things that you mentioned was screening. Just to talk a little bit about screening in general, the premise of a screening exam is to help us to detect whatever it is we're looking for at the earliest time when it's the easiest to treat. So there are a variety of recommendations for when to begin screening for breast cancer, which is why we say in general, breast cancer screening should start at age 40. And this is a conversation that I really encourage all women to have with their primary care provider, whether that be a primary care physician, family practice, internal medicine,
or gynecologist.
Is if that's who you're primarily seeing. Your history is your history. Your family history is your family history. Everyone's genetics are different. Everyone's family history is different. And those things, as well as your personal makeup, are going to put you at a different place as far as your risk for breast cancer, and may make a difference as to when you need to start screening. So for the general population, it could be 40, but if you have someone in your family that had breast cancer at a young age, or a male with breast cancer, because men get breast cancer too.
I was going to say that next.
You may actually need to start screening at an earlier age. In addition, there are certain genetic factors, like I mentioned, that could put you at a higher risk for breast cancer. There are testing that not everybody should have or is eligible for, but if you have a very strong family history of breast cancer, you may be one of those people who should consider getting a genetic test to see if you're at a high risk of developing breast cancer. Why? Because if you have that information, it allows you to make important decisions for your future, for how often you're getting screened and the different type of screenings that you're going to have. It's very important because, especially with breast cancer, we know catching it early means it's the most treatable. So all these things, though, are really hard to know and determine on your own. That's why you really need to have the conversation with your primary care provider, whoever that could be.
I encourage patients to absolutely have the conversation with your primary care provider, but talk to your family.
Yes.
We in the South, a lot of times, tend not to talk about health issues or people passing or why they passed and the specifics behind it. So it's so important when you have those people at your disposal, those relatives you may not have spoken to in a while, or you just don't speak about that with them, to sit down and find out what your family history is. We see so often that women really just don't know if anybody else had breast cancer or a gene abnormality or got genetic testing for it, or they had breast cancer, but we don't know if they got tested for this, that, or the other, what testing they had. We just know they had breast cancer, they had a mastectomy, and that was it. But it's important to have those conversations with your family for your health, for the health of your children, so that you know what to ask and you can be informed about the questions you asked. Breast cancer is one of the most common cancers in the United States. And although the majority of people who get breast cancer are 50 years and older, as Dr. Vincent previously mentioned, younger women get breast cancer, as do men. One of my best friends is a man who had breast cancer, and that changes the risk stratifications for his children, his nieces, his nephews, everyone around him. So it's important to have these conversations, like I said, not only with your healthcare provider, but with your family, so that everybody is aware of the best way to take care of themselves.
And the good thing about talking to your family and friends about it too is that, especially with screening, it can be scary. People are afraid to take that first step and get screened. But if you grab a family member, grab a friend, go together. It can be a lot easier to take that first step. People think, well, you're not going to prevent it from happening by not getting screened. Right? Okay. So best to figure out a way that can make you comfortable to take that first step to get screened. In addition, even though we can't run from our genetics, there are certain things that we can do to minimize our risk of getting breast cancer. Health habits that your primary care provider can help you with, but maintaining a healthy body weight, frequent exercise, limiting alcohol intake, not smoking. So those things can greatly improve your chances of staying healthy in a lot of different ways, but especially if you have, you're at risk.
Regular self-exams. Self-breast exams are very helpful. And you want to make sure that you do your self-breast exam at the same time every month, because our breasts can change depending on where you are in your menstrual cycle, if you're premenopausal, postmenopausal. So it is important that you try to do it at the same time every month. And that's when most women actually, and their husbands, catch breast cancer. If you notice symptoms, if you feel a lump, a bump, a change in the skin texture over your breast, or pain in an area that you previously didn't have, or you know what? You know you best if it just don't feel right. At the end of the day, if it just doesn't feel right, it's better to go get it checked and have some reassurance, or know what steps to take next. So breast cancer awareness, we promote it every year. We have football players wear pink. We go out and we have all kinds of campaigns, but it's because we want our mothers, our sisters, and our friends around with us. And the sooner you take care of it, the sooner you know, the earlier you can get intervention, the more successful that intervention, and the less invasive that intervention.
Right. Every one of us has been affected in some way from breast cancer. There's not a single one of us that doesn't have a friend or a family member who's been affected. We all have a story, or personally, people have been affected. And so this is why we really hammer home on this every year, because we want you to get involved in your screening and encourage that of your family and friends as well.
And if you've been diagnosed with breast cancer, we at Louisiana Blue can help guide you through that healthcare journey. Navigating the healthcare system can be
absolutely beast. And that's for people who really know what we're doing. It's still difficult to navigate.
It's frustrating at best.
Yes.
It can be
impossible at
worst. And if you're dealing with a serious condition like a newly diagnosed cancer, it can be impossible and difficult to go through. So we at Blue Cross are here for you. We have a whole healthcare team that can guide you through that journey and make each step a little more pleasant or less painful than it would have to be otherwise. So please contact our team. The number on the back of your insurance card, you can always call us. I'm at the 1-800 number, and we can
and that's at no cost too.
Absolutely,
that's at no cost.
Our healthcare coaches at no cost.
Louisiana Blue members that we really need to encourage you to access when you're going through any kind of cancer journey in general. But certainly, since we're talking about breast cancer, that's something that we think everybody should make part of their care plan.